And today I will be presenting our ER innovation project in which we reduce wait times for certain individuals in the ER room. So our first patient has a concussion, in which case they'll be taken by ambulance to the ambulance side entrance and directed to the second floor for urgent matters. They'll take an elevator all the way to the second floor. After arriving on the second floor, they'll be led to an examination room. In the examination room, they'll receive a medical evaluation by a neurologist. They'll receive a physical and neurological examination that consists of vision, hearing, strength and sensation, balance, coordination, and reflexes. The doctors will also take a look at the patient's medical history to see if this has happened before. Related testing includes cognitive testing, such as memory and concentration. Since we are dealing with a concussion, we also have to look at their brain, as there is risk of head injury. A standard test used for concussions is a CT scan. After arriving on the urgent floor, they'll be led to an examination room. Fuck! After arriving on the 3, 2, 1. After arriving on the urgent floor, they'll be led to an examination room where they'll be seated by a doctor or nurse, and thereafter a neurologist will provide medical evaluations. These examinations include, but are not limited to, vision, hearing, strength and sensation, balance, coordination, reflexes, as well as cognitive testing such as memory and concentration. Further testing may be needed as this is a head injury, such as a CT scan or MRI, in which case they'll be led to the CT room to take a scan. After the CT scan, fucking time. Three, two. Hello, my name is Franco Oropesa, and today I will be giving you an overview of 3 patients going through our hospital model. Three, two, one. Hello, my name is Franco Oropesa. I am part of the specially abled group, and today I will be giving an overview of our ER room, specialized to reduce wait times by categorizing emergency levels on 3 different floors. I will be testing 3 different patients and their path through the hospital, what their experiences are, and what actions are taken with them. Three, two, one. Patient 8 has been diagnosed with a concussion. Patient 8 has suffered a serious head injury and therefore has to be taken in an ambulance to the ambulance side entrance. Since this sounds like an urgent level threat, fuck! Patient number 8. After answering a call to a football game, EMT ambulances arrived to find a teenager in the midst of a football match suffering a head injury. Head injuries usually result in concussions, therefore they are urgent. He is taken to the elevator and taken to the 2nd floor. After arriving on the 2nd floor, he will be taken to an examination room, where he will be seated by multiple nurses and doctors. In the examination room, he will receive a medical evaluation by a neurologist. Many tests, including but not limited to vision, hearing, strength and sensation, balance, coordination, and reflexes. They will also take a look at the patient's medical history to find prior similar Fuck. After arriving on the second floor, they will be led to an examination room where they will be seated and a medical test will be done by a neurologist. These include vision tests, hearing tests, strength and sensation, balance, coordination, and reflexes. They will also take a look at the patient's medical history to see if this has happened before. Other tests such as cognitive testing, like memory and concentration, will also be conducted. If the patient fails some of these tests, further testing is required, such as CT scans and MRIs, where they will be taken to a CT scan room. They will receive multiple scans of cross-sectional images of the skull and brain. Thereafter, they will be taken to an MRI room, where it uses powerful magnets and radio waves to produce detailed images of the brain. After arriving on the second floor, they will be taken to an examination room to be seated by nurses and doctors, and a medical evaluation will be conducted by a neurologist. The neurologist will conduct vision, hearing, strength and sensation, balance, coordination, and reflex tests, as well as cognitive testing like memory and concentration. If the patient fails any of these tests, further testing is required to look into the brain and its activity. These tests include CT scans and MRI. A CT scan is a standard test in adults to access the brain right after an injury. It uses a series of X-rays to obtain cross-sectional images of the skull and brain. After the CT scan, they will be taken to an MRI, if needed. The MRI shows changes in the brain or to diagnose complications that could occur after a concussion. It uses powerful magnets and radio waves to produce detailed images of the brain. After an MRI, there can be further treatment involved, such as pain management, like meds for headaches and any discomfort, as well as personalized plans to help recover from a concussion. If needed, the patient can stay overnight to observe any further changes to their psyche. After a lady and her husband were mowing the lawn, the lady had caught her fingers in a lawnmower. This is patient 9. She quickly removed her fingers, however, not without deep lacerations, causing intense bleeding and swelling around the hand. However, the patient also has HIV, so any and all personnel attending to her must always be wearing protective gear. As she has a disease and is bleeding profusely, she will be led to the emergent care room, led into an operation room, seated, and taken care of by professionals. They will apply local anesthesia to the lacerations by an anesthesiologist. The bleeding has been stopped by the lady, so immediately cleaning the wound and sterilizing with alcohol is a good idea. Thereafter, stitches will be applied to stop bleeding further and heal up the wound. They will remove the rope the patient has used as a tourniquet and use their own. They will also begin blood transfusion as she has bled profusely. There will also be an EKG and a patient monitor to see if the patient is not going into shock, such as hypovolemic shock. After the patient's heart rate and blood pressure is back to normal, they will take her to an X-ray to examine if there is any damage to the bones. Stool, urine, and blood sample tests must be done to ensure everything is okay with the patient and to ensure no further treatment will be necessary. Our next patient is an 18-year-old male. He came in at 11 a.m. complaining of an incredibly itchy eye, which is red and appears to be discharging on the eyelid, which is preventing the eye from opening. Personnel coming in contact with the patient must wear protective gear such as eyewear, gloves, and masks at all times. And if it is not necessary for them to physically touch the patient, they must remain distance. Patient will be brought to an examination room on the 3rd floor as it is not as serious through the elevator. After arriving on the 3rd floor, which is meant for non-emergent patients, they will be taken to an examination room, seated down and questioned by nurses and doctors. Questions like medical history, allergies, the start of the condition, pain, symptoms, and anything that may have caused it. The patient will have normal levels taken, such as blood pressure, temperature, weight, etc. The patient will wait for the doctor to come in and examine his eyes and diagnose him. The diagnosis has shown that it is pink eye. Since it is not as serious, the doctor can write a prescription and any necessary sick day notes if needed and will send him on his way. Thank you for listening to my presentation. That is all for the patient path of our ER room in an efficient 3-layer emergency level rooms. That is all for patient paths in the ER room. Thank you for watching.